Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers Podcast. And today we are back for another episode with Tara Quintana. This is not a Q&A episode. We are going to get into a discussion of why it is so important to look beyond the thyroid gland versus just looking at the gland itself, and maybe just optimizing blood values. So Tara, welcome back to the podcast as a full-on guest. How's everything going today?
It's going great, Eric. Thank you. I'm very excited to be here.
So some people may not know your background. So give everybody some background on you, how you got into this kind of functional medicine space, and a little bit about your story.
Yes, awesome. So I have a background in oncology, hospice, and then women's health. And then, as I feel most people who travel down the functional medicine road, I developed lots of issues myself. And my thyroid became enlarged. I had nodules. They told me I had lymphoma. Mm-hmm. It was like a horrendous period of time where I was set to do chemo and everything. And I ended up, after I had my thyroid removed, which is really not the strategy for lymphoma anyway, but I couldn't swallow and I was losing a lot of weight because of that. Mm-hmm. I found Hashimoto's, and it literally, like, it changed everything about the way that I think about medicine. And I went back to school. I went to the Institute of Functional Medicine because, well, I started that when I thought I had lymphoma because I was looking for, how am I going to survive? And I was the one in the classes with, like, my hand up saying, what's the protocol? What supplement do I take? What do I do? Like, give me, like, what's the magic? And, there is no such thing as a magical supplement and a one-size-fits-all approach. And so it was a painful experience, so to speak, with me going through this because I was essentially standing in my own way. I didn't want to do any of the things that you talk about in your book that I talk about on a daily basis with all of my patients and clients, which is like the most important components of health, like the fundamentals of health. Like, how are we sleeping? What's our stress level like? Like, I was sleeping 4 hours a night. I had no stress management and I was over exercising. So when I really honed in on all of this, it changed everything about my life. So that's what brought me into the functional medicine space and brought me to where I am now.
So I want to get a little clarity on that a little bit. Like you talk about, I found Hashimoto's, almost like you found the love of your life. Now I'm guessing that's not the case, but you're in a traditional allopathic world and you've got a diagnosis of lymphoma, and then you say you found Hashimoto's and that kind of changed things. Let's break that down a little bit. What does that really mean? Like, you found out, oh, maybe what I have going on is related to this disorder called Hashimoto's, or what do you mean by that?
Yes, let me clarify. So when I was in this very dark place, thinking of having lymphoma, I started to want to run a lot of tests. So I really dove into expanded testing, and because I already had hypothyroidism, right? So I had hypothyroidism for years, but as well as I do, we don't really, well, in functional medicine, hopefully we do, but in conventional medicine, we're not really looking at why. So we're not looking for the reason behind an underactive thyroid, and you just get put on levothyroxine like I was put on. So I did more expanded testing, and that's when I found off the charts levels of antibodies. And then I actually dove deeper in the rabbit hole because I have a very strong family history of immune system issues. My dad died at 57 and from vasculitis. He had lupus. My mom had Hashimoto's. There was a lot of autoimmunity. So when I actually went to see a specialist, I saw several specialists. They told me there's nothing I could do. that I have horrific genes, and it's just part of my journey now. So
Right.
I ended up checking for antibodies to other things, which we had talked about on a Q&A, or one of the Q&As before. And I found antibodies to a lot of things. I ran a lot of panels, and it terrified me because I was living in this state of fear. Like, I am at war with myself. And in conventional medicine, there's not a plan. Like, I saw a rheumatologist, endocrinologist, and some other specialists, and they said, right now, everything is stable. This is going on because I had vasculitis markers, antibodies to myelin, and multiple other things. And they said, right now, everything is stable. So as soon as it gets really bad, we'll give you medication. So immunosuppression, or even chemo for some of these. So I didn't have cancer like I thought I had, but in my future were the same or similar drugs, and I had no other route. Like, that was it. We're waiting. We're in a holding pattern for when my body completely shuts down. And I was not well. I had my thyroid out at this point. So, like, I should have been fixed.
So let's break this down a little bit, because I think this is really important for listeners to kind of get a gist of this. Like, number one, you got diagnosed with hypothyroidism first. Were you on medication at that, then got put on medication for thyroid condition first? That happened first.
Yes, that happened first,
Okay.
years before.
And so what you then, I'm guessing you came to learn over time as you were doing that research that, actually what I have is thyroiditis, and that thyroiditis was probably what led to the original diagnosis of glandular hypothyroidism to begin with, right?
Yes, absolutely. Yeah.
And so I think that's important, because people think they get hypothyroidism and then later they have an immune driven problem. And you and I think would agree, there's really only three primary causes of glandular hypothyroidism, right? Where the gland can't make enough thyroid hormone. One of those is that medically the gland is destroyed, which happened in your case, right?
Yes.
Actually, you've had all of these happen, right?
Yeah. Yes.
Potentially. So the gland, it gets destroyed. That's option one. Option two is there's not enough iodine coming into the system or getting to the gland to actually produce thyroid hormone. And the third option is that there is immune-driven damage to the gland, right? Those are the three options. The challenge is we don't look for iodine deficiency in today's model. We don't investigate what's driving it, an immune system issue, and we don't take glands out unless there's overt pathology going on. And overt pathology that they're worried is going to turn into something else, right? Like a cancer, but just damage to the gland. So that the challenge with those three models is it never addresses any of the issues, right? Like, what's driving the immune issue? Do I have an iodine deficiency? And if I remove a gland, does that restore? If I remove a gland because there's pathology, I haven't addressed what caused the pathology, right?
Right.
So how long were you on thyroid medication before you developed what somebody thought was lymphoma, or did you develop another immune-driven problem even before that?
So I was diagnosed like around 4 years prior.
Mm-hmm.
And
with the Hashimoto, with the glandular hypothyroidism. Yeah.
Yes.
Okay.
And I was just put on medication, and they found it by accident, just with a regular screening, and said, this is what you have. I'm like, okay. So I get put on the medication, and I honestly would not have known I had it because I didn't feel bad. I didn't have any symptoms at all, which gives me a lot to think about now. Did I really need? I already know your answer to this. Did I really need to take medication when I had no symptoms? So then fast forward, about around 4 years, and I'm at my yearly visit, and my practitioner felt a nodule. So sent me for an ultrasound, and I'm like, I don't notice anything. And it took with our healthcare system a month for me to get the appointment. In that 1 month, my gland, it was like somehow in my body, it was like, let's speed this up. And it started growing so rapidly. It was very noticeable. And I was like constantly clearing my throat. It was very scary, like almost like a suffocating feeling. And when I got the results of the ultrasound, they're staged, with different levels. And it was like the worst one, like the TR5. And I had multiple of those on both sides. And, reading that. And then so the pathologist said, or the radiologist, that I need, well, and my primary, that I needed a biopsy. So then fast forward several months, and it was worsening. So I literally could not eat solid food. And I started losing all this weight. And of course, my background is oncology. So I have a lot of oncologist friends. I called one of them, and I had them look at my information that they had already, which was essentially just the ultrasound report, and met with them. And so by the time the biopsy came back and showed, and you can't diagnose lymphoma from a fine needle biopsy. And I know this, but this is what they, a whole group of people said. And an oncologist I trust, obviously I trust him with my life, because he was going to be in charge of my chemotherapy treatments, that this is what it was. And now looking back, I mean, I was obviously terrified. It's hard to think clearly when it's you, right? But I'm, in research, I must have read hundreds and hundreds of papers all about this. And when my thyroid was removed, there was no component of this that I thought it wasn't cancer. I told my kids, like it was like a done deal, so to speak. And then the pathology it didn't show anything. It was just significant lymphocyte invasion.
Okay. So let's pause that for a second. This is really important. So you get all this lymphocytes, and so can you give it like a definition for what lymphoma is? You have like a simple definition?
Yeah.
People are going, what is lymphoma?
It's essentially where our white blood cells, in particular lymphocytes, are not, they're in overdrive, essentially. They're not working. I hate using the word normal or correct, but it is and it's system wide. So lymphoma is usually not a thyroid. That's why, again, it's not a thyroid issue, because it's more of
not thyroid specific, because that was going to be my next question. So you kind of got there already. But when somebody has lymphoma, essentially they have an upregulation and infiltration of the tissue with their white cells, especially the lymph, into the lymphatic tissue, right? So you get an enlargement of that, all of that. I guess it's just, you just called it an exuberant, excessive immune response. And I guess in general, we call it a cancer, right?
Yes.
And so when you got this diagnosis of lymphoma at your thyroid gland, was there lymphoma elsewhere, or?
There was no other biopsy done, but I had significantly enlarged lymph nodes on various parts of my body. It was, and I had classic signs like night sweats. Granted, my age puts me where I could potentially have night sweats, but they kind of came out of nowhere. And then I started having this extreme fatigue. So clinically, that's how I presented, like very, very enlarged lymph nodes, like not only like here, which is like significant, but even like behind my knees. And it was like that's why the clinical picture looked like that. But it is, I mean, thyroid cancer itself is not, it's not as common as maybe somebody would think, but this more lymphoma thyroid issue is very rare. So it was such, and I couldn't think clearly because I was terrified. Looking back, I feel like a lot of things could have been done differently, but I was just along for the ride, even though I was a practitioner. And that's when I went into functional medicine. So then, of course, there I am, where you and I have talked about this before, with this allopathic mindset, practicing functional medicine, just looking like for every lab to do. I spent thousands of dollars, thousands. And all it did was make me more terrified and make me feel even more that something is wrong with me, when now I understand that, you know, the immune system was in play for years. Like you said earlier, like what comes first, right? Like Hashimoto's is what I believe I was already going on. I didn't catch it. I didn't wake up one day and catch Hashimoto's. You know, there was a dysfunctional immune system like brewing for quite some time. And by the time it led to any clinical manifestations, there was such significant damage that I don't know how else it could have been managed by the time it became that enlarged, because I couldn't eat, right? I mean, at that point, it becomes more of an acute issue versus, you know, something that's more chronic. Like the treatment for Hashimoto's should not be remove the gland. Although I've seen this numerous times, and surprisingly, or my sarcasm there, people don't get better because they haven't addressed the immune system issue, like the root causes for why this happened in the first place. So the immune system is still like upregulated.
Right. Yeah. So when you kind of listen to that story, and this is maybe the story of other people too, they get diagnosed with hypothyroidism, but nobody looks at the underlying cause. And because they don't look at the underlying cause, which is either the iodine deficiency or it's some type of immune driven problem. Now, the second piece of that, if it's an iodine deficiency, taking thyroid medication is not going to fix that, right?
No.
The second part is, if it's immune driven, then we have to ask the question, do we believe this is a dysfunctional immune system, or do we believe it is an adaptive response, as I think it is in a lot of cases? I don't think it's typically broken physiology. I think it's part of an adaptive response to the cell stress response. And, you know, it could be different depending on the person. It could be different things, right? It's not one or the other, and it could be both at the same time. And definitely, if you have chronic persistent immune upregulation, can that lead to dysfunction over time? Absolutely. So I'm not saying it can't, but and especially for the listener, if we just take, if the immune system is dysregulated, and we truly think it's just a totally dysregulated immune system, and it's damaging the thyroid gland, and we don't do something about what's causing the immune system to be dysregulated, the chance of having more immune-driven disorders and more significant tissue damage is inevitable, and that becomes a problem. The other issue is, if you believe, as I do in most cases, these are adaptive responses, and the downregulation of metabolism is the adaptive response, and then we force more thyroid hormone potentially into a system that doesn't want it, do we potentially increase the risk of driving more lymphoma over time? And this isn't something that's well studied, but there is definitely literature on the fact that thyroid hormone, the downregulation of thyroid hormone, is a protective adaptive response. There's papers on it. More papers are coming out in the last couple of years. Definitely, there's papers that talk about thyroid hypothyroidism as a protective response against cancer. And there's some discussion that excessive thyroid hormone can exacerbate or drive lymphoma to be a greater risk of lymphoma. So like, this is a big deal. Like, what are we diagnosing? And are what we diagnosing the real, are we diagnosing the cause, or are we diagnosing the disease as a result of the cause, right? And that's a big deal, because what do we treat? We're treating the diagnosis, right?
Yeah.
And so, hey, this is lymphoma. I need to treat lymphoma. You know, we just remove the gland because the gland's diseased. Okay. The lymphoma was the effect.
Mm-hmm.
And so by removing the gland, did we change what caused the lymphoma in the begin with? And if the answer is no, then what are we doing? But I understand the model, but this is, I think, an important part for the listener. And then the other thing I think that you said, and I think sometimes we have to be careful, and we all kind of fall into this thing, is what I have Hashimoto's, right? And people go, okay, I have Hashimoto's, I have to fix Hashimoto's. Again, we have to go back and say Hashimoto's is the description that there's thyroiditis with antibodies, or there's antibodies present. And the presence of antibodies doesn't always mean there's damage to the tissue. And lack of antibodies doesn't mean that there isn't damage to the tissue. So this idea that the antibodies are telling me I have this disorder is kind of like a slippery slope, because a lot of these people have thyroiditis, but they don't have antibodies yet.
Yes.
Right. And other people have antibodies. My antibodies are 100. I have Hashimoto's. Well, I don't know that you do. There might have been some damage at some point in time, and there's antibodies, but they're not like Pac-Man eating away the gland. We call them predictive antibodies, and say, hey, there might be some damage going on to the gland, and this could indicate there's thyroiditis. But it doesn't necessarily mean just because you have antibodies that you have these things are like little Pac-Mans eating it up. So sometimes people think I have Hashimoto's, or I have positive antibodies there, therefore I have Hashimoto's. So I need to go down this path, versus I don't have antibodies, so I don't need to go down this path. Maybe I just need medication. And that's where I'm making that kind of, I'm trying to kind of make this little nuance there. Do you understand what I'm trying to say? And maybe I'm not doing a good job of it.
No, I absolutely understand what you're saying. And I feel like you hit the nail on the head several times. And I've been using that expression a lot lately. And first, with talking about, is it really like the immune system issue is first? Like, because why would the immune system become dysregulated? We are not designed to like self-destruct. We would not have survived the way we have. Like, we're designed to not just survive, but thrive. So if there's an immune system dysregulation, it is a result of something else. So it's that swimming upstream and looking for it. And you opened my eyes years ago to the concept of an adaptive response, because again, I was in a conventional medicine model where it's, what's the lab? Is it high or low? And what age are they? What sex are they? What race are they? Here's the protocol. If that doesn't work, you try this. And that doesn't do anything to change what's happening under the surface. So like, that's the first part, is we don't just catch an immune disorder either, even if we have genetics, which I clearly do. And so many people I work with have this, but that's not a like signed, sealed, delivered, like you're done for, because there's other factors to that. So if our body is adapting, why is that? And we're down regulating metabolism and it's changing things. And when I talk to people about the concept of antibodies, because I do agree with you, I didn't maybe in the beginning, because I feel like it's hard to really understand, even with a medical background, because I'm thinking of these Y-shaped antibodies, right? And they're over there and they're like on my thyroid. So they're doing something. I don't believe that they are. Well, I don't have a thyroid anymore, but you know what I mean. But it's a signal. Like our immune system sees I call it like tag it, like it's tagged whatever, a body part, a food. That's what we do. And it's amazing that the immune system does this. This is how we survive. It's not looking for self. And when I learned this, it really opened my eyes even more. It's looking for danger. So if it's perceiving like our own tissue is danger, then there's a reason. And I mean, but it isn't like like everybody, it's this, right? So it's for me, when I did my timeline and matrix, like the functional medicine essential tools, I checked every box for what could put somebody on a trajectory for dysfunction. Not sleeping. I was eating Doritos and Skittles and for lunch and thinking, I'm not overeating, so it doesn't matter. I was over exercising, no stress management. I lived in a state of like this. I was under such stress, and I kept saying, "You got this, Tara. Do it. You're tough. I did that for years, And I work with so many people that we're driving ourselves into the ground. And when somebody gets diagnosed with Hashimoto's, my sister was recently diagnosed with Hashimoto. She's good with me sharing. And they're like, okay, well, your labs are good. Otherwise, as soon as they're not, we'll give you the standard of care, levothyroxine. Others are diagnosed with Hashimoto's and they're put on medication with even normal labs, right? And then I ask, how are you managing the immune system? They're like, I'm taking levothyroxine. I'm like, that doesn't do anything for your immune system, and potentially it could be making things worse because there's an underlying issue that's never been addressed, and our bodies are much more intelligent than we can shove whatever in, a medication, a pharmaceutical drug, a supplement, and think we can like work around what the body is already doing. Does that make sense?
Yeah. And I think the challenge is that we don't, many times in both allopathic and functional medicine, is that we provide a treatment strategy. And I think this is where allopathic treatment strategies have a tendency to work better, because they're trying to manage a condition, not restore health per se. And so if somebody's in what we call homeostatic regulation, that's like low stress, optimal physiology, right? I'm in balance. I make as much energy as I need in any given day, and I can run all the systems in my body optimally. That's homeostasis. Allostasis is I'm under an excessive level of stress for which I can't efficiently make energy, and I have to down-regulate some of those systems so that I can shift energy to the more important needs, okay? And we don't have our normal operating system. I think in allopathic medicine, the goal is to manage the condition or the symptoms. So they don't really worry about the fact that if somebody's not going to respond maybe the way they want, because they're not trying to restore health, they're just trying to lower blood pressure. And those medications really do a good job to some degree in making immediate changes to a piece of chemistry, right?
Yes.
But where I think we struggle in functional medicine is that we see somebody who's got health-related issues, and we provide strategies that we think should work to restore homeostasis. but the person's not in a state to get to homeostasis. They're still in that cell stress, cell danger, allostatic regulation. So the strategies we apply don't work for long periods of time, or they work when we give them and then they revert. And people are like, this is where they're frustrated, or they see a bunch of practitioners, or they're not, or they take supplementation and they react to them and they're confused, or they think it doesn't work because I tried that, it didn't work. No, the strategy was likely appropriate if you were at a point where you reduced the stress load and your body was now into heal, restore, and restoration mode. Then yeah, those strategies of gut repair and detoxification, all those things may be more effective long term. But if you are still in that stress response, that allostatic regulation, and we do something to manipulate your gut flora or to reduce the inflammation in your gut, it can have an effect to change those things. But then we remove those things and then we're shocked that it goes back to the old model, like the old symptoms. And we go, well, why didn't that work? Well, it worked temporarily, probably, because we were doing the same thing medicine was doing,
Yes.
but we were expecting a different outcome, right? We're expecting it to get better. Allopathic medicine's not expecting the blood pressure to get better. So you have to take it forever. We're applying a strategy to say, hey, we want to give you some magnesium. You're going to take this for 30 days and your blood pressure will get better. And then we're like shocked when after 30 days, we discontinue the supplement and the blood pressure goes right back up. Well, why didn't it work? Obviously, magnesium doesn't work. No, the magnesium may have helped manipulate the system, but our thought process is initially this is a strategy to restore health, but the person's not in that healing mode, right? And this is why somebody winds up on 42 different supplements a day, because they're now trying to manage all these signs and symptoms with supplements potentially versus medication. And I'm sure I got off target here, but I think that's the issue. I think that's where the frustration really lies sometimes in this model, is because you want to apply strategies to restore health, but that the person's not in a healing and regenerative and restorative state. And we have to play this game where we're reducing and eliminating the stressors, managing systems, and then once we can get that load down, that's where we really see the magic in the changes. But we have to kind of make sure that the patient understands it too. I did 30 days of a gut support product. How come it's, I finished it like 2 weeks ago and now my gut symptoms are coming back, right? Because you're still in severe stress response. I had a call the other day with somebody and we were talking about what was going on. And one of the things that they said in the process was, I think it was general. I may not have exact, but it was like, I'm afraid to get better, is what they said in the conversation. And I was like, maybe that's why nothing's working, right?
Yes.
Because the fear of what happens when I get better keeps you in this state and limits your success, right?
Yes.
I don't know what's going to happen. So we get stuck. We get comfortable in our uncomfortableness, right? It becomes, even though it's uncomfortable and I don't feel well, I know this. And so so subconsciously, even though the person might be seeing people and doing strategies that on paper should be working, the mindset is there's danger out there potentially if I get better. There's uncertainty out there if I get better. So subconsciously, their mind was probably sabotaging all those efforts. So did they see people who are bad clinicians or had bad strategies? Probably not. But mindset was probably setting them up to maintain this safe place, right? Versus getting better.
I love that you brought that up, Eric. Like, I have goosebumps because this is like my life's mission, is to spread the word that first and foremost, what we believe or don't believe will directly impact what happens to us and the road we're on. And you brought up I'm tried everything. I've done everything and I feel a little bit better. And then I feel worse again. I'm working with a woman. She's had her issues for over 40 years. She's tried everything. And she told me, I've done everything. I've done this protocol, that protocol. I've tried this diet. I've done this, I've done all of these supplements and I'm not better. So she essentially said, what, do you have magic? I'm like, no. But the problem with everything that you've done is, one, it's not personalized. It's completely generic. And I'm sorry, there's no part of 700 calories a day indefinitely that's going to be helpful for anybody, especially with immune system issues, which was one of the things that she had done years ago as a protocol for weight issues related to Hashimoto's, which is ridiculous, right? But her body wasn't ready. Like her body, I call it prepared. That's like the first part of my program. Her body wasn't ready, but it's not just like the physical body, like it's not just the body, it's the mind, like the mind. And she flat out said when we first met, it's impossible for her to get better. She has no hope. Like, you will not get better if that's what you believe. And I understand disappointment, but the things that we say, like, and I say this all the time and it sounds crazy, but I know it's true. We'll have to see what you think about it. But like our cells and our microbiome hear our thoughts. So when I think about that, it literally changed the way I talk to myself, because I was habitually, I can't do that. I'm not good enough. This will never happen. Things are never going to work out for me. Oh, it figures. Things always go wrong. And when I realized this, I'm like, do I really want to send this message to my body? That, like, what are the things that we're saying to ourselves? Like, if we have been burned before, is it the program? Maybe. There's a lot of garbage protocols out there that really get under my skin, because they don't look at anything that actually makes a difference. It's Band-Aids. It's that bucket. Here's your $2,500 worth of supplements. That's going to fix you. It's like, and you brought something else up that I loved, that, you could be taking the magnesium for the blood pressure, or you could be taking selenium because your thyroid's out of whack, right? But it might work for a little while. You go off of it and you're not any better. Like, how does that even make sense to me? Like, is it really that simple that if we shove in this supplement, and selenium, of course, is what most people are thinking about when it comes to the thyroid, but is it changing anything underneath if the issue for why there's such a dysregulation isn't a selenium deficiency? It may be, right? It's possible, but maybe it's the fact that they're not sleeping, or the fact that they are extremely negative, or they've had trauma early in life and they don't want to put themselves in a position to feel good. I mean, I feel like that's kind of what you were talking about, like limiting beliefs about ourselves. And so
Absolutely.
What is it doing?
Yeah. And for the listener, it doesn't mean just because you have positive thoughts and positive beliefs, like everything like, I'm going to win the lottery. I'm going to win the lottery. I'm going to win the lottery. It doesn't mean you're going to win the lottery. But like, I think our goal our goal in functional medicine should be that we can't make promises that we're going to cure whatever your condition is. We can't make promises that we're going to necessarily meet all the goals, realistic or unrealistic goals that you have when you come to us. What our job should be, and what we should try and express to our patients is, my job is to take a look at your big picture, your web of function or dysfunction, and say, what can I do here to reduce or eliminate the things that are putting excessive stress on this physiology? And what can I do to then rebuild and restore health? And I call those the fitness factors. How can I make somebody more fit in each of those categories? And if we're doing those things, then we should be moving you from a high straight stress allostatic state closer to this homeostatic state and a higher level of health. So in medicine, we are diagnosis driven and treatment and management driven. Like you have cancer, so we're going to try and manage it. I would love to say the goal is to cure cancer, but because we're never identifying what the root issue is, we're just trying to really manage the condition versus cure. But in functional medicine, people, what can you do to fix my Hashimoto's? Well, your Hashimoto's is the result of excessive cell stress, and we have to identify what those cell stressors are. We need to reduce or remove those. So the cell physiology shifts from allostatic regulation to homeostatic regulation, and then you can start to heal, repair, regenerate. And if I can find those things, reduce them or eliminate them, and support that recovery, you're going to get healthy and well. And then a lot of these signs, symptoms, and disorders are going to go away. But that's really what our mission is. Like somebody says, what's your goal? I want to lose weight. And I want to not need medication. Okay. Well, the weight is the side effect of the chronic inflammation and cell stress. So that's not going away first. You may lose some weight initially. That's probably going to be water weight and inflammation that goes down as we manage that. But to start to burn fat as a primary fuel, unless you really aggressively shift yourself to ketosis, that's not going to be the primary source of calorie loss. We have to get the rest of the system to shift from allostasis to homeostasis before you're really going to see efficient fat burning. And I think that's important because people come in with an idea of what they want to accomplish. Well, in medicine, if I say I want to lose weight, they can help me lose weight real quickly, right? They have a tool like a semaglutide that manipulates or biohacks chemistry, even though you're in an allostatic state, and you'll lose weight. But that's a different model than helping you shift from allostasis to homeostasis and then optimize your overall health. That's biohacking, that's manipulation. And it's not that it's right or wrong, but it's not what we do, right, in functional medicine, or it's not what we should be, in my opinion, what we should be doing from a functional medicine perspective, whether it's hypothyroidism, weight loss, blood pressure, that's why diagnoses kind of suck, but we need to have names for things because people hang their hats on those. This is what I have, because we've grown up with that model. But ultimately, what our job is different than medicine's job, traditional medicine's job. Our job is to find out what's driving the process, reduce it, eliminate it, and shift somebody's regulatory system. Ultimately, that's what our job should be. So
I agree, and educate, and education is a really big part of who I am, is to empower, for the woman, the 40 plus years and a negative mindset to thinking and linking, going through the matrix with her and showing, do you see how this can lead to this? And she said she really didn't think anything could surprise her, but she's starting to see there's a connection. Because if in conventional medicine, you go in, you have the problem, you get the diagnosis, you get the drug. So, and there's little to no conversation, right? You just, people tell me all the time, I'm on all these medications. Why are you taking them? I don't know. They gave them to me.
But even for you, that connecting and linking, I don't know, and you can correct me if I'm wrong, but even in your story, you may not have connected the primary hypothyroidism with the lymphoma. Your doctors may have never made that connection. Hey, these two things are linked. I don't know. Maybe they did. Maybe they didn't. Maybe this, maybe you would think somebody would go back and go, wait a minute. We got thyroid lymphoma. This person's got glandular. We've diagnosed this person with primary hypothyroidism. Maybe they always had thyroid and immune-driven thyroiditis, and this has led to but it wouldn't really matter anyway. because the treatment would still not have been to go back and say, well, what caused the thyroiditis? The treatment would have been the same. And so for the listener, that's why this discussion is important, because you're, especially when you're talking to a functional practitioner and then going to your medical practitioner and you're like, they're not saying that's not important. This isn't important. Why, how could you say it's important? These labs are important and they say it's not important. And it's because we do two totally different jobs, right? And that's the key. And so what I want to do now, because we spent quite a bit of time on it, we're struggling to get to the next piece of this, is I really want to talk about, and we've been talking about it indirectly all the way along with your story, but there's a lot of focus when somebody gets diagnosed with hypothyroidism. And traditional, it's, people are going to get diagnosed with primary hypothyroidism, maybe some clinical hypothyroidism, but there's so much attention on the gland and the optimization of blood values. Do you see this as a problem, and why?
I absolutely see it as a problem. I didn't always see it as a problem. It took years of really digging into the literature and seeing like that it doesn't work. That's the main reason. If we're focusing only on the thyroid, it's like people telling me I have Hashimoto's but it doesn't matter. It's just my thyroid. Like my surgeon telling me, we're going to remove your thyroid because there was a chance I could have kept like a little piece of it, but it doesn't matter. You're already on the medication, so you'll just take more of it. It doesn't matter. He literally said it doesn't matter. It absolutely matters, right? Because I'm looking at the underlying issue for what's driving the hypothyroidism. Is it really the thyroid isn't working? Like, I don't buy that. Like it's, as you say, it's adapting. Sometimes I use the word reacting. It is an amazing part of our body that is affected by everything around us. Like it's part of our, our endocrine system. So I'm thinking about our hormones. I'm thinking about like chemicals and messages throughout the body. And so if we only narrowly focus on the thyroid, we're missing the most important part that could potentially make somebody go down a much worse pathway. If we're only doing labs, don't get me wrong, labs, I do think that they're important. I run labs all the time. But if we're only trying to like knock somebody into this optimal range of blood values and saying we're good, we're just keep putting more medication in, what is happening underneath? And in my situation, I had the medication and, my labs were normal, but my immune system was on overdrive. And it was not only making antibodies and leading to infiltrating lymphocytes, which is why they thought I had lymphoma to begin with. It was this like massive attack of my amazing immune system, thinking it's protecting me against my own thyroid. So, I mean, I'm looking at it like, if we're not looking at the why for whatever it is we're treating, if it's blood pressure, why does somebody have high blood pressure? What are they eating? What are they thinking? How are they sleeping? All like you talk about all the time, I talk about all the time. Could there be something else going on? Yeah, but we need to know. We need to know what's going on. So I argue that Hashimoto's impacts the thyroid, but it is not a glandular problem. It's an immune system issue.
Yeah.
And the issue isn't a broken immune system. It could be overreacting or like on overdrive for multiple different reasons. And I don't know if I feel like you would agree, and I'd love to know what you think. If we have like poor sleep and we're not getting any sleep, and it's leading to our, I always do this, our barriers, our intestinal barriers, even though it's like this, like making them like leakier, that is a huge red flag to our immune system, because it's only going to recognize amino acids like water, minerals, and vitamins. It doesn't understand what undigested protein. It is a signal for danger. So if we have, you know, in my research, one night of poor sleep can cause our lining to get slightly leakier. Not to be afraid of that, just to be aware of why having a sleep routine is important. Then if we have things getting in and it's driving up an immune system response, could that be an issue? Could that be a driver? I say yes. That's for autoimmunity. That's a piece of the puzzle, this altered intestinal permeability, because if we have, you know, 70 to 80% of our immune system is in our gut, it's one of the biggest points of entry into the body. And again, our immune system is amazing. So if somebody's having all these issues with food, issues with weight, headaches, you know, whatever, if for a woman of the right age, you know, having period issues, things like that, it could be connected to like a whole web of things. Like you said, the web, like the matrix web. And that's what I love about functional medicine, because it's looking beyond a lab value. Like how many people have you seen that they bring you the labs and it's like, you know, for years, like stacks, right? And it's like they say everything's normal, and or like one lab is out of range, and then it's like they increased my dose, and I'm always asking, what else are you doing? Like what is your management plan? Is the management just the medication? I feel like I might have gotten off topic
No.
there.
So when we think about the gland damage is the result, right? Or the lack of production is the result. And so if we just focus on the gland itself and say the gland is damaged, not why, but the gland's damaged, then the general theory is, well, then all I have to do is replace what the gland makes, and we forget about the downstream, right?
Yes.
So that's a huge issue. The other issue is the optimization of blood values equals optimization of thyroid homeostasis in all the cells and tissues. And that's not accurate either. But let's take the gland itself. Like when somebody has hypothyroidism, we talked about if it wasn't medically induced, like radiated or removed, there's two primary causes, right? Do you look at iodine levels to say, okay, is there a pattern that you look at on labs to say, I think this is an iodine deficiency pattern, and maybe we should be focused on supporting iodine levels if the person's truly deficient, and what might inhibit iodine absorption, utilization? Or do you not really take a look at that and just assume that people have plenty of iodine in the system and just go start looking at what's driving the immune system?
That's a great question. And first, I don't assume anything, at least I try not to.
Mm-hmm.
I look at whatever labs they already have, and I will run labs, but I have this strategy where I really want to bring the focus to that individual and like taking like a step back. Because
Mm-hmm.
if we're driving up the immune system, because again, people coming to me
Mm-hmm.
with they already have Hashimoto's,
Mm-hmm.
right? They already have an immune system dysregulation. So my number one priority is to like take a breath, like try to veer away from all of these multiple other diagnoses usually, which is I have this, fibromyalgia, chronic fatigue syndrome, you know, and like my body's just broken. take it from that mindset to more of a, like, getting the body, like the foundations, like you talk about again in your book, getting the body like ready for anything that we're going to be looking at. Because if we have this, if we're in chronic stress, our intestinal barrier is likely breached, because stress is one of the drivers of causing this, leaky gut, which is really a hot topic. Everybody's talking about it. And the answer to leaky gut is just a bunch of supplements, which I disagree with, because, the answer is understanding why. So that's a long way of saying, I really want to understand the why behind it. So a lot of times it can involve labs also, but I've seen through my own self and, hundreds of other individuals I've worked with, the fastest route to somebody actually feeling better and coming into balance is to like shift focus from just like the labs, medications, and supplements to the underlying principles of health, and also understanding like the triggers, the mediators, that individual's antecedents that put them on the trajectory, so that if we don't know, right? So like if we have no idea and we're like, I don't know, I just got it, I just caught it one day, then how are we going to be able to remove the alarm that's triggering the immune system? We have to understand, and this is what's missing, and what I'm very passionate about. Again, I care about labs, but in my experience, most individuals have already had like almost every test under the sun. Like they're coming to me, they're like, they've had, a GI map, they've had, the Dutch test, they've had multiple things, and they're like, nobody knows what to do with me. And they're in a state of significant stress. I say it's like health stress. So I got off topic a little on that one too.
No, I think I'll summarize that for you. Like it sounds like when you're working with a person, your focus for a lot of these people is to just get back and start making sure that the foundational pieces are addressed first, because they've probably already been to a number of people who've done a bunch of testing and tried to treat them supplementally with protocols, and they didn't work. And that's where we started in the beginning. Like, why don't the protocols work? Well, it's a bad doctor. It's a bad protocol. The reality is their foundation is, their level of fitness in all these foundational categories is so low that there's no way they can be in a heal and restorative mode. And so you're just taking a different take on this, maybe at the onset, and saying, hey, these are the things that we need to make sure we've got managed first. And then we can cycle back and say, okay, now that we've reduced your emotional stress, now that we've got you sleeping, now that we have you breathing better, now that we know your relationships have improved, now if there's permeability issues and we've applied some support strategies, we should be able to see some improvement, long-term improvement and change of, say, the GI inflammation, the permeability, the food reactivity. And I agree with that part. I think sometimes we can do those things. We need to do those things separately because they've missed that piece of it altogether, and they've just been doing so much. That's definitely a strategy. If I have seen somebody coming in with more than like 10 supplements, the first thing I'm really having them just focus on is, over the next 3-4 weeks, let's remove these supplements and work on these health and life strategies, not take tests, because I don't want to know what their lab work really looks like on 40 supplements. I want to know who they are without 40 supplements. And I'm not talking 40 capsules. I'm talking 40 bottles of things, or 30 bottles of things, right? Which adds up to like 40, 60, 80 capsules or more per day, when they're doing that stuff. So we're not even getting a valid measurement of who they are. We're seeing the manipulated biohacked version of them with all the supplementation. So I agree with that part. but I'll answer the next part. I'll answer the question I was posing, which is for my strategy, and if I know they've got multiple malabsorption issues, I'm probably not reaching right away to look at an iodine assessment, because if they're deficient in a whole bunch of other things, they're probably deficient in that too, because they have compromised gut physiology. So, but yeah, there's ways to test to see if somebody truly has an iodine deficiency, and there's things, and so yeah, you could do that. Physicians could check it. Why don't physicians do it? Because for years we've been told that iodine testing is not valid. There are people who were taught that nobody who's got a thyroid condition, especially if they've identified TPO antibodies, should be on iodine, because iodine makes the thyroid worse. And there's this camp of anti-iodine, even though iodine used to be what we used for everything in the day. If you had a cut, you got iodine. If you had an illness, you got iodine. And if you had something going wrong, you got iodine. Like, iodine was in everything, and somehow we didn't have as much thyroiditis as we do today. There is a whole nother camp that says almost everybody's iodine deficient, and therefore, we need to be really repleting these people with massive doses of iodine. I don't know that that's wholly accurate either. But my opinion, for somebody who gets diagnosed, I think before they see you or me, they should read part 3 of the thyroid debacle and make sure I'm eating a healthy whole food diet, right? It doesn't need to be AIP. Maybe it even shouldn't be AIP. It should be focused on it and a whole food based diet. But they should be doing all of those things. Are you raising your level of fitness in all those categories? Because that doesn't cost anybody any money to do those things. They're essentially free. And then if you're doing as good a job as you can with those things, then the next question that we need to ask is, do you have a glandular thyroid problem, or do you have a cellular thyroid problem, or do you have both? And if there is a glandular problem, is it caused by iodine deficiency or thyroiditis, or both, right? If it is, if you don't know, then you may not even be able to tell from the labs, because a person's so over medicated. But for me, the next step is, okay, for one of the first things I got to do is the person over medicated? And if they are, we need to get their levels back to, and this is going to sound weird, but people are like, so many people in our space and are trying to optimize the blood levels and wind up over medicating people. And the medication becomes the problem.
Yes.
And so sometimes you can't actually see the pattern that's going on, because a person is so over medicated and supplemented when they get to us, that many times I'm like, all right, the first thing we're going to do not only is wean down on supplementation, but here's the recommendations for how we need to get your medication weaned down to somebody who's sick. That sounds weird, right? But if you believe my premise that when somebody has a cell stress inflammatory process going on, and there's adaptive decreased conversion of T4 to T3, then I want their physician to get them to a level of thyroid hormone support that supports or optimizes their current state, not an optimal health state, because this is not a person who's in an optimal health state. They're not going to use that thyroid hormone as an optimal health state. So if this is a person with a chronic inflammatory condition and they had a reduced conversion of T4 to T3, I don't want to load them with T3, because that is not optimizing their physiology in a sick, inflamed state. Could it change their physiology? Sure. Is it optimizing their physiology? I would argue no. Okay. And, it's like saying, okay, I lowered their blood pressure. Does the blood pressure medication change their blood physiology? Sure. Does it optimize their health? Maybe not, because while we may have reduced the cardiovascular risk, we now have induced poor circulation to the brain and extremities, and now we've probably accelerated their cognitive decline and the development of neuropathy. So what we've really done is just switched out which condition we concern more about, right? So from a thyroid hormone perspective, I want to get them down to the point where I'm like, okay, you have enough T4 in your system to be able to convert to T4 or T3. We're not over medicated. We're not under medicated. And this is who you are. You have a reduced conversion from T4 to T3, or we may actually see a pattern of over conversion in that situation because the person's truly iodine deficient. And so for me, like, I want to do all those foundational and fundamental things, but if we're going to be gland focused, those are the two things to me that we've got to be concerned about. Is this a person whose glandular hypothyroidism is caused by iodine deficiency, or is it thyroiditis, immune driven? If it's iodine, or is it both? And it could be both, and I've seen it be both. Okay, and especially people on lots of medication, they've got iodine deficiency, because as we shut down and drop TSH too low, the sodium iodide symporter not pulling iodine into the gland because there's no demand for it. It doesn't need to be there. So those people often on an anti-inflammatory diet, autoimmune paleo diet, and thyroid medication are often iodine deficient because it's not coming in and they can't really utilize it very well. So then the other part of it is, if they have just thyroiditis, then we've got to be focused on, as you said, what's driving it. And that's where we look at those. Too often, or sometimes too often, we're in a hurry to fix the virus, the gut, the chemistry, like the detox pathway. And we're not looking at the things that you were mentioning, like sleep and respiration and emotions and relationships and all those things, which probably have the biggest influence and create some of those problems, right?
Yeah, absolutely. In my opinion, with myself and hundreds of people I work with, that is what moves the needle the farthest. And the protocols, they'll work for some people. That's, they're there, they'll work for some people, but they're not going to work for everybody, because everybody doesn't have the same thing happening underneath the hood. Mm-hmm. So like, it's very important to me to, first and foremost, when I'm working with anyone, to educate and then empower them that they actually have they have all of the power when it comes to their health. Like, people ask me, like, do you have a magic wand? Because I'm always mm-hmm. waving my pen and saying this is not magic, because it's not. And I have no power over another individual. I cannot mm-hmm. make them eat a certain way, sleep a certain way, think a certain way, do anything. But they have that power within themselves if they understand the why behind things, if they have a solid why for their life, and it's purpose driven, that I don't have to accept this diagnosis, that there's a lot that I can do, not just wait for, okay, what are we doing with my medications? Or like for me thinking, am I going to end up, because of, now I don't have a thyroid, so Hashimoto's doesn't matter, right? Because I don't have the gland anymore. But all these other body parts and antibodies and dysregulation that was going on with me, it doesn't matter, because then we'll just wait and then just suppress the immune system. That I really want to open people's eyes, that we don't have to sit and wait, because so many people tell me that, they're totally discouraged. They feel hopeless. They feel helpless. But they don't understand that these foundations that we keep talking about, that they are that important. So like putting an individual in the driver's seat, because they're not in it usually. They're sitting and waiting for somebody to tell them what to do. And that, like, oh, wait, so I have some kind of say as to if I stay on this dysregulated pathway. in my opinion, they're the only one that has a say in that, because I can't do, and you can't do these things for anybody else. So they can continue on a cycle, on like the hamster wheel of conventional medicine, like I call it, get a little bit better, because you raise the dose, then you start feeling worse again, then you have to raise the dose, you start feeling worse again, then you do a gut reset. But all along, that individual is living in a state of, I'm never going to be okay. So I do feel like that it needs to be addressed. And in my opinion, when we look at these things first, it's not like sexy, right? Like nobody wants to, maybe some people, so people could disagree with me, just wants to start with like mindset and thinking about their vision for their life. They're telling me they don't have a life. I'm like, but what do you envision? Like, what do you want? Because they're in such a state of like dysfunction, not only physically, but thought processes, that they don't believe that their body is capable of healing.
So it sounds like from your perspective, one of the biggest things that people need to be working on when they have any chronic health issue is definitely what goes on between the 6 inches of their ears. Is that fair to say?
Yes, you just say things so eloquently.
But so somebody might be saying, right, it's easy for you to say, but how do I change that? So let's talk about some strategies that somebody might need to utilize that can help them get their mindset right and get their mindset into one that's going to help them heal versus maintain the the danger, the fear mentality, the limbic windup, and the sympathetic dominance that keeps them sick. So what are some of those strategies that you recommend to people to help that?
I love this question. And one of my favorites is affirmations. And this is where I was actually working with somebody years ago and I didn't get anything out of it at the time, because
Hmm.
she was teaching me these things and I was like, yeah, yeah. And like thinking in my mind, this is a waste of time, and I didn't do it. So I didn't get any better. Then years later, I understand, I do it, and wow, it actually, like, it works. So thinking of things like a positive statement, like I am happy and content. I am fulfilling my life's purpose. When I had my thyroid removed and I felt my self-esteem was very low, I actually had somebody tell me I looked disgusting. Like, I'm not dead, so there's that. It's what it is. But I was in a dark place because I still didn't really understand what was going on with me. So I wrote, "I am beautiful," and I put it on my mirror in the bathroom. Like when I get up in the morning, I would see it. So thinking about like positive affirmations, I I've seen them to be a game changer, but it's a hard sell. I was actually talking to a woman last night about this, and she said, "Well, I know what they are." I said, "Do you do them?" She said, "No, but I know what they are." I'm like, "Will you try it?" Like, will we go into it with an open mind? Because if it's closed, it won't work. So what I usually recommend is, even if it feels ridiculous, to do it, and just do it like as an exercise, like 3 times a day, once a day, and let it play out. Give yourself the space in order for it to like actually do something with it. I'm a fan of visualization. So with everybody I work with, I have them craft what's called a wellness vision. And I
Hmm.
always ask, do they know what a wellness vision is? And they're like, I don't. I've kind of, maybe it's something about how we're well. And that's essentially like a statement of how we envision ourselves at our most, this is not English, like grammatically correct, at our most well state.
Mhm.
So not where we are right now, but where we envision ourselves, what we want. This isn't I'm 15 pounds lighter, because that's not a vision of wellness. That is some type of a goal, or what somebody like, we'll just keep it as a goal versus a vision. So like, as an example, when I was crafting mine, I was very unhealthy. I did not feel healthy. I was miserable. I felt like I didn't like, it was hard to get out of bed, and I was not fulfilled. Even though I was doing a job that I loved, I felt like a shell of a person on the inside. So I said, I am happy, I am healthy, and I am fulfilled. And it felt awkward to say it. So I have done this with hundreds of people. Not one person, they usually say it with a smile on their face. And I'm like, how does that feel? Like, they craft it. I don't do it for them. And they say it feels really weird. And I'm like, okay. I've had two individuals cry when they said it, because they said the mountain in front of them just seems like they're never going to be able to tackle it. But an amazing thing happens when we start with like a grounding practice, like a focus of something like this. It like sets us on a trajectory where there's a possibility. Like, then we have this vision. Okay, like somebody else, like, I am energetic and able to show up for my family. I am motivated and can get the job done. Like, whatever somebody's vision of, it could be like, a wellness isn't just health, right? There's all states of wellness. But when we create the space for it, we're already starting to change stuff here. And when we change stuff in our mind, when we change our thoughts, that is going to change like reactions in the body, neurotransmitters, everything shifts. It's going to change hormones. I'm looking at like the way in which it like goes through the body, because I will tell you this, Eric, after somebody does this, immediately, they're like, I feel ridiculous. And maybe a week later, 2 weeks later, there's a shift. Like, they feel different. They're like, I'm not sure what changed, but I'm feeling hopeful, because that is very important. If we have no hope, then there isn't a possibility. So those two things, I start with the wellness vision, and then moving to affirmations, visualization, thinking about moments like where they felt really negative, and maybe thinking about how to reframe that, and
Mhm.
writing it down. I'm a fan of writing things down and sitting with it, sitting in a state of maybe feeling uncomfortable. And this was very hard for me. Again, these are the things I did last. That's why I was unwell for so long, because I didn't want to change anything about the way that I think,
Yeah.
because I didn't believe it was possible. And as soon as I changed that, like, it's not a miracle, right? But in some
Yep.
ways it is. So
Yeah.
that's the
So
gist
I
of
think
it.
the visualization piece is important. I think I talked about this a little bit in the book. There was, one of the things is that what we think about and continually think about, we can, is it's more likely to become our reality, right? And we can get really good
Yes.
at things, even with the visualization piece. I think it was Maxwell Maltz and cybernetics, where they talked about how they had they brought a bunch of regular people in, and they had 20, I'm just making up the numbers because I don't remember the study, but maybe 20% of the 20 people were told to shoot free throws every day, and they were going to come back in 60 days. Another 20 people were told to just visualize taking free throws, for a certain same amount of time every day. And then the third group was told not to even think or shoot and come back. And the group that did the best was the group that did the visualization, not the group that actually shot the shots. And so what he proved in that is what we believe can happen has a better chance to happen. And we can, almost manifest skills by just visualizing it. And that's where you see, athletes today at the Olympics, elite athletes kind of rolling through, visualizing what's going to do, So we're doing it anyway. What most people don't realize is you're visualizing anyway what your day is going to look like, what your week's going to look like, what your life's going to look like, what your health's going to look like. But what we don't realize is that for many of us, it's negative, right? It's I'm going to be sick. I'm going to have a hard time getting up. I'm going to be in pain. I'm not going to be able to do this. I'm not going to do that. So you're still visualizing every day, whether you realize it or not. So I think what Tara's trying to tell you is you can choose, if you put work into it, what you visualize. And once you start to visualize what you want, you start crowding out the things you don't want from a visualization perspective. And then you've got a better reality that those things are going to come to bear. And you'll start to do things that align with your vision, because you're already doing that anyway. Because if your vision really subconsciously is, I'm going to be unhealthy, then you're going to do more things that are unhealthy. You're probably going to do more things that are unhealthy to match that visualization, whether it's conscious or subconscious. And if you do something that's really unhealthy on a chronic basis, you're going to be like, well, I'm going to die anyway. So what's the big deal, right? Versus, you know what? I probably shouldn't do this very often, because my goal of my wellness vision is that I'm going to be climbing the mountains, of Kilimanjaro in my 70s, and this doesn't get me there, right? So I think that piece is important. The affirmation thing I think is important, but I think this is where some people struggle with the affirmation piece, and I maybe me too. When I started doing the affirmations, my buddies who were really into it. The challenge is we have to learn how to write affirmations so that we're not lying to ourselves, which is my opinion, right? If you like, I am rich and I have millions of dollars, your subconscious will be like, that is BS if you don't have it, right? I am happy all the time. BS, right? And so now we can create this inner conflict. So my only add to that is that when I think affirmations are critically important, and again, you're affirming to yourself on a conscious, subconscious level every day, I look terrible in this. I look terrible in this. I don't look good. My eyes are baggy. I got black spots. Like I'll never get what I want, right? So you are affirming to yourself. So what are you affirming to yourself becomes really important. But I think you want to craft those affirmations to make sure you're not creating more inner turmoil with an untruth, right? So if you say, and you might disagree with what I'm saying, but if you say, I am optimally healthy, and you're not, that to me, that's going to create inner conflict. So a better affirmation to me would be, every day I'm moving closer to achieving a more optimal state of health. And that can be a reality, right? That can be true if you're doing those things versus I am healthy. So to me, and I'll let you have a final point on that. Do you think that that's nonsense? Do you think it depends on the individual, or do you agree with that comment?
I absolutely agree. And I'm really glad that you brought that up, because if we're not aligned, if our brain, if there's like, if something doesn't connect, it's like if I say, I'm so depressed, my body's like, wait a second, why is she smiling? That there needs to be alignment. So if I said, I have healed my body and I'm like extreme fatigue, I have anxiety, I don't necessarily think that's the best strategy, because I don't think we're going to get the most out of it, because I feel like the purpose of an affirmation is to more refocus us on the positives of what we have. So I am committed to the work to heal my body, I am, like you said, I am becoming less anxious all the time. Like something, like it doesn't have to be like I am, like I think I used before, I am content. Somebody has to some level feel content. Like maybe that's their overarching view of themselves, but they find themselves in like a mindset of like they feel like things are not going the way that they want them to go. like to reframe that in to remember all of the times that they are, or it could even be, I am content most of the time, or I thrive in a state of contentment, or I know when I put my mind to something, I can achieve it. Right.
Yeah.
Like I do believe that
Yeah.
So yeah, absolutely.
So I think that's the key, because if you even we'll use that content, like you can say, I am always content, right? That can be a lie, right? Because you shouldn't be
Yes.
always content, right? Like
No.
I'm never necessarily 100% content with what's going on. I'm happy with the state I'm at. I'm content with this, but I really want better, right? So
Yes.
I think that's the challenge, is we have to make sure we craft these things so that we have the alignment of what we want with the alignment of the reality, right? And so if you're a person who's really overweight and chronically tired and fatigued, your affirmations wouldn't be, I am optimally healthy. It would be, I am starting today and every day, I'm taking steps to improve my health and well-being. That would be a positive affirmation that you could repeat to yourself. You're not lying to yourself, as long as you're continuing to do it. And the reason you're saying it to yourself over and over and over again and writing it down is because when you write it down, it creates a neural signal to your brain, and you are more likely to do those steps you've just told yourself 10 times, 20 times out loud to your brain, that you will take some steps today to do something to improve your health and well-being. And you have a way better chance that you're going to do at least something that day to improve it. So Jen, Tara, I always call you Jen because I have a friend I grew up with. Her name was Jen. I'm not sure if it's Quintiliana. Yours is Quintana, but it's Tara Quintana. But it's like a mental thing. But what you do is really spend a lot of time on these fitness factors and working on them. And I think you have like a program, right, that you offer to really work maybe within a group, within a community, to work on these things. So can you tell the audience a little bit about your program?
Sure. First, it's called the Hashimoto's Recovery Blueprint, because I'm a visual person and I'm married to a carpenter. So that's why I named it that. And it is an interactive, like education-based program with bite-sized, like understandable things to help to reframe from a diseased state to a working towards a recovery state, a healed state. And there needs to be actionable steps. So I have there's cringy things to me, we'll just use that word. And the concept of a program that somebody buys, they go online, they buy a program that they're likely not going to even go through, and they're doing it on their own. I don't think that works, because we're losing the most important part, which is it being personable. It needs to be personalized rather. And so it's like a program where they're working on things, actionable steps in a systematic way. Again, it's backwards of how, I did everything backwards. So when I was structuring this, I was looking at where would it make the most sense to work on this? I did the mindset last. Well, it's going to really take a long time to get where you want to go if you don't believe it, right? So when I structured it that way, and then with coaching, so I actually went back to school again because I wanted to understand more about human behavior, because it isn't just about me waving my pen as a nurse practitioner. Not that I should be doing that anyway as a nurse practitioner, but learning how to coach another individual, not telling them what to do, but what do they want? And it's it's amazing when to see the transformation, especially with a group setting, which can sound intimidating. I've been in groups, and at first I was really intimidated. I didn't want to say anything. What if I say something wrong? But it's not that type of a group, because then we can learn so much more from somebody else. And it's very inspiring. And then being able to work with somebody one-on-one also. And if somebody gets stuck, but these foundational principles where I'm looking to like prepare the body is the first pillar, just as a spoiler alert, because if somebody's goal is that they want optimal health and the strategy in the past was labs and supplements, they're not any better. That's why they're coming to see me. So I don't have those in my program because I want it to be the foundation of looking for the root causes of why it's going on, getting the body ready to actually like remove the triggering alarm and work on healing the body in a multifaceted way. But everybody is different. So it can't be the same road for everybody. What, drives you to get Hashimoto's is probably not the same thing as what drove my immune system issue. And then like looking to like rebalance at the end. Like I call it like a rebalance because the body's definitely imbalanced if we have disease processes going on, adaptive states in the body, and people that I'm working with, most of them still have their thyroid. And, looking at like removing the alarm, getting the body into a state where healing can actually happen. So obviously thinking about the gut and again, like all of the foundational principles of health so that they are empowered and they understand what to do 5 years from now if something else goes on. Because can we like reverse Hashimoto's? Yes, I've seen it. I've seen it numerous times. Can we use the word cure? Well, no, right? And that's not, we shouldn't be saying that word, at least not at this stage, right? Because they say there's no cure for autoimmunity. I know you don't like that word, immune system disorders, but we can get it reversed so we're not actually creating any damage. The immune system is no longer triggered. Things shift in the body. And when that happens, like all of these other symptoms, they go away. Like I've had so many people say, what could this actually help, my eczema? How is it helping my eczema? That's not why we're doing this. I'm like, well, we have one body and all of these cellular processes. And when we really work to like get ourselves on the best health trajectory, it's going to have a positive downstream effect versus a negative downstream effect that we see typically, right? Like we have a disease and then we just keep get more medication and more diseases. So that's a long-winded way.
All right. So you've got a program. Where can somebody find the program?
Through my website is the best, Quintana Functional Wellness. I'm sure you'll link it.
I will.
I have more information. I also have a free masterclass where people can learn even more about steps that they can take right now to start putting themselves more on a healing trajectory. Perfect.
So if you are interested in kind of just learning what some of these foundational things are, you can pick up a copy of the Thyroid Debacle, go through part 3 of the book. You can reach out to Tara and go to her website and learn more about what she does and her program. And you might thrive more in a community setting than maybe trying to work on this on your own. So if you're interested, if you have, and I would say it doesn't really matter if you have Hashimoto's or don't have Hashimoto's or a thyroid condition or not have a thyroid condition. If you're struggling with some kind of chronic health signs, symptoms, condition, likely everything that Tara is going to talk about in her program, everything that I talk about in part 3 of the Thyroid Debacle is going to support a healthier state and give you the better opportunity to get a chance to get healthier and to get well. Because if you're not doing those things at a high level, I can pretty much guarantee you that no program, no functional medicine strategy, no allopathic strategy is ever going to help you recover your health. You have to be doing the foundation thing. So, Tara, thanks so much for coming on the podcast. And we will talk again soon.
Yes. Thanks so much, Eric.
You got it.